Happy New Year from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. This month's message is going to focus on the George and Dina Breece Fellowship and our announcement that we will be hosting either one or two fellows this year during the summer. But first, I wanted to just relate some legislative information to get started with the new year. The 117th Congress wrapped up in December with a $1.7 trillion spending bill to fund the federal agencies. Unfortunately, there were a number of healthcare riders and other types of legislation that were expected to potentially be attached to that legislation that were left on the cutting room floor. In many instances, or associations and lobbying organizations around town were disappointed with the bill, and the O&P field was no exception. The Medicare O&P Patient-Centered Care Act did not make it into the legislation, despite significant progress on moving that forward, meeting with the Congressional Budget Office, and making some real progress on that issue. We'll have to revisit that in this Congress. The NAAOP and other O&P organizations will be meeting over the coming weeks and months to figure out exactly how we proceed and design a legislative strategy moving forward. And we will invest in and invite our membership to be part of that process. The good news is that the orthotic and prosthetic Medicare fee schedule did increase by over 8% in 2023. That's a massive increase, one that we haven't seen in quite some time. And we hope that that will relieve some of the economic burdens of the current marketplace. Now on to the Breece Fellowship. We are announcing the Breece Fellowship today. We are looking for qualified applicants, users of custom orthotic or prosthetic care who have an interest in O&P or healthcare public policy and advocacy. These fellows will, once competitively selected, will come to Washington, D.C. for a 10-week program this summer, starting in late May and ending in early August. It's a paid internship. There will also be a number of field trips, if you will, to O&P practitioners and clinicians, and exploration of state advocacy as well as federal. But the bulk of the fellowship will consist of Washington, D.C.-based policy and advocacy, learning the process, understanding Washington, attending hearings, meeting with congressional staff and members of Congress, helping to organize and run the NAAOP virtual fly-in, and all other kinds of activities to educate and train our young leaders for policy and advocacy efforts in the future. We hope that these fellows will get the Washington bug, as they say, and spend some of their time, if not maybe even go into a career that focuses on O&P and healthcare advocacy in Washington or in their state governments. So the deadline for applications is February 28th, 2023, and a decision on the fellow or fellows. We'll either choose one or two, depending on resources, depending on the applications we receive. The announcement will be made by March 24th of 2023, and then, as I said, begin in late May. We encourage you to send our application to alert your patients or your colleagues if they use custom orthotics or prosthetics and have an interest in public policy and O&P advocacy. We encourage you to encourage them to apply. There are just a few requirements and a number of criteria that are preferred, but not necessarily required. So we're really looking for talented people at the, emerging in their careers and would be interested in a fellowship of this nature. We very much appreciate our support from our member organizations and NAAOP's friends to run this program. We've had 5 fellows come through this program over the last 4 years, and 4 out of 5 are currently fully employed and working in the O&P field, and 1 is doing extraordinary work for NAAOP with respect to our social media platform and messaging on behalf of O&P. So thank you so much. We appreciate it, and looking forward to describing some regulatory priorities for 2023 in our next update in February. Thanks so much.